Hello friends, are you someone who has undergone knee replacement surgery or someone in your family has gone through knee replacement surgery? Then I'm definitely sure about this fact that your doctor would have recommended to go ahead for physiotherapy sessions. Now, definitely a physiotherapist must be coming at your home, or you must be going, or some way you are going through physiotherapy sessions, right? Now, beyond that, there are certain exercises if you do by yourself during this time after your knee replacement surgery is done for 1 or 2 months. It helps in improving the mobility that you achieve in your knee joint. And that's why I'm going to show you some simple exercises that you can do immediately after your knee replacement surgery is done. You know what? Gone are the days when after knee replacement surgery you were supposed to take rest, you were supposed to be on bed. Nowadays, immediately as soon as your surgery is done, you are allowed to walk. And gradually we have to progress and make sure that your knee moves as soon as possible. The idea is to prevent the secondary stiffness and the sutures adhesion that happens very commonly. That's why more these exercises are done, the better it is for your knees. So let's get started and see what are these exercises. So first thing what I'm going to do is I'm going to lie down and show you the exercises that you have to do in sleeping position. So here I'm going to take a bedsheet roll, place it below my affected knee. So imagine if this knee is affected, what I'm going to do is I'm going to place this bedsheet roll below my knee. I'm going to press my knee downwards and then I'm going to relax. Press and relax. You can sit in this way and do it, or else you can lie down and then do it as well. Press, relax. 2, relax. 3, relax. 4, relax. 5 and relax. Now, after this, let's move on and see the next exercise. For this, you're going to bend your knee and then make it straight. 2, straight. Remember, you need to bend only as much as you can. 3, straight. 4, straight. 5, straight. Similarly, you will do for other leg. 1, straight. 2, straight. 3, straight. 4, straight. 5 and relax. This was the second exercise. Now moving to the third exercise. Here we are going to lift the leg up and down. Here also you just need to lift the leg as much as possible. Also, to make it more easier, you need to bend one leg and then lift up and down. 2, down. 3, down. 4, down. 5 and relax. Then we'll bend this leg, make this leg straight, then lift up and down. 2, down. 3, down. 4, down. 5 and relax. Now similarly, we are going to take a turn to one side. This way, bend this leg, make this leg straight. Now here, consider this is my affected leg and I am going to do the exercise for my affected leg. That's where I have kept this bend. So now if you have got knee surgeries for both the legs, just try to take out this leg slightly bent and now try to lift the leg up and down. Try to lift it as much as possible. 2, 3, 4, 5, 6, 7, 8, 9 and 10 and relax. So here now we are going to do some exercise in sitting position. For this you will place one leg back, one leg front. First you are going to keep the affected leg back, and then you're going to press this leg in the backward direction and then release. 2, 3, 4 and 5. Now when you do this, you have to ensure that you are pressing this leg as much as you are able to. Okay, so the more you bend, the better it is. So you can do this for 5 to 10 repetitions. Similarly, this leg you will now support backward, and now you will try to lift the leg up and then bring down. 2, down. 3, down. 4, down. 5 and relax. Now post this, we are going to do some ankle pumps. So sitting, you're going to lift your ankle up and down. 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10, and relax. Now let's do some exercises on walker. Now definitely there are some exercises that you have to do in standing, but you have to make sure that there is a support always, ideally in walker. Right now I'm not having a walker, that's why I'll be taking support here, but you can do this exercise using a walker. So the first exercise that you will do would be marching at place, or is lifting the leg up and down in this way. You can also do some walking practice with the help of walker. And the last thing that you have to do is, consider this is a walker which I am holding in my hand. I am trying to lift my leg up and down, leg up and down. 2, 3, 4 and 5. Similarly with other leg, 1, 2, 3, 4 and 5, and relax. So friends, these are the simple exercises that you can do after your total knee replacement surgery. The exercises are simple, pretty effective. Only thing is, make sure to share this video with your physiotherapist before starting the exercises, because it's always safe to work under somebody's supervision. And if you want our help in working on your recovery, then feel free to log on to www.healthqrehab.com, or else download HealthQ Rehab app and book in consultation with one of our expert physiotherapists. They would be able to help you to work on your recovery process. On that note, let me end this video here and see you in another video. Thank you.